Hi, everybody. Christian Sinclair. I'm in Kansas City. I'm a palliative care doctor. We're still a relatively new medical specialty, so there's a lot of great information we have in our specialty that I thought we could get out there and we could spread to a wider audience. And so I really first saw Twitter as a big benefit for medical conferences. But what was great is we realized there are lots of interesting uses for it as physicians and nurses exchanging information to say, well, this was the talk I really thought was interesting. These were the pearls from the plenary session that I went to, or the concurrent session I went to. But what was really interesting is the jump from 2010 to 2011, and what happened in that interim period is that we started the Hospice and Palliative Medicine chat, which is it's a weekly chat that happens on Wednesday nights at 9 p.m. Central. And so you see from 2010 to 2011, there's a really large jump in the number of Twitter users, and I attribute that a lot to having a very consistent, frequent chat amongst clinicians. There were many people who weren't at the conference, and lots of anecdotal tweets from physicians who said, I couldn't make it to that conference, but I at least still feel like I'm connected to that organization, to that conference, to my colleagues that are there. I'm fairly young. I've been out of training for 10 years, about to turn 40 here, but next year I will be the president of our physician organization, the American Academy of Hospice and Palliative Medicine, and one of the reasons that I think that's really happened is because of my engagement on social media. It's been sharing my thoughts and opinions through HPM chat, through Twitter, that has helped me get enough visibility that people say, hey, this guy has some decent ideas.
I'm a family physician in a small town here in northeastern Ohio called Salem, Ohio. I signed up for Twitter in 2007 when it really was hot in the tech community, but I admit that I really didn't use it that much when I first signed up for it. I wanted to learn about what people were doing with it. I do get new patients. Because of my presence on Twitter and social media. In the past 5 years, I've had more and more new patients come to me and say, Dr. Sabella, we're here because we Googled Salem, Ohio, and family medicine, and your picture is right there, and we saw your blog, and we saw what you do on YouTube and Twitter, and that's why we're here. And I really believe that my presence and my experience on Twitter and social media has really helped me refine to be that effective television physician, that effective communicating physician that we don't get training for in medical school.
One of the things that got me interested in social media in the first place really was trying to understand more about what my patients go through. I've tinkered around with all sorts of different websites. The one that I find most useful now is Twitter. An important point about this also is I'm an introvert. I'm not someone who likes to go out and do things, socialize a lot in real life around most issues. I like to be home early at night. But one of the things about social media is it allows you, if you find something you're passionate about, to really pursue it. And so I found Twitter very helpful for that. What I found is it was much more easy to be conversational. You could discuss things more easily. You could connect with people that you didn't have to know already. And I could learn from people that weren't doctors. And I did find, and I still do, that I'll see things in my Twitter feed that I know is going to come up in the news or will come up as questions that people have that I may have to answer about the latest radiation issues in breast cancer care. And so for me, this has been very valuable to help in terms of what I do in my practice. Great way to really get a sense of what's going on for patients. And I found it very helpful as well, like Christian mentioned, to participate in meetings from a distance. You can network with people. It's been great. I think it's really the way I got to know Lee and Mayo Clinic the best. But through that, it's really just been a rich experience for me to learn from a variety of people.
I was at our local state radiology society meeting, and one of our national society members, Geraldine McGinty, who is active in leadership at the American College of Radiology, gave some excellent lectures at our state society meeting on socioeconomic and political issues related to radiology, and at the end told us that she had recently joined Twitter and was finding it valuable and suggested it as a way to connect with her and with other radiology leaders. But over the next couple of months, I started to realize that what I wanted to use Twitter for, as some others have mentioned, is networking with other individuals who have similar ideas to mine, similar interests, clinical interests in radiology. when somebody prominent in your field gives a lecture at a meeting, you can go up to them and meet them in person because you feel like you've already known them. You've connected on a level on Twitter already. Now that I'm connected to people who have similar interests, now that I follow societies in areas that I specialize in and journals, I find that a lot of the latest research actually comes to me. I don't have to go looking for it. It finds me. And that actually saves me a lot of time. And then finally, as I've gotten a little bit more involved in Twitter in particular, it's increased my visibility. You start to see the power of connection. Leading into this meeting, the RSNA actually sent an email to the top 20 radiology tweeters asking us to help live tweet the meeting on behalf of them and on behalf of ourselves. I felt very honored to be included among the top 20 because I'd only really been doing this for about a year. And that visibility has really led to additional connections. I've been invited to moderate tweet chats in areas of interest to me and my specialty. I've been asked to give lectures. There was an article in the New York Times, I believe it was mid-December, talking about this subject, radiologists are reducing the pain of uncertainty, and I commented on this on Twitter, talked about how we're trying to do things to help radiologists communicate with patients here at Mayo, and Geraldine McGinty, who was the radiologist that essentially has inspired me to join Twitter, asked me would I write a blog post for the American College of Radiology on this subject. I haven't been asked to be president of the National Society yet, but I have been asked to be president of the local radiology society here in Minnesota. So I found it to have been a really valuable experience for me in helping me to advance my career. And one of my colleagues who was essentially poking fun at me said, Amy's making her career on Twitter. And I think for most physicians, we're not trying to make our career on Twitter, but for me it really has helped me advance it and accelerate some things that I wouldn't have been able to do without the connections I found on Twitter.